Today's session on urethra. Here we have to discuss about both male and female urethra. Urethra extending from internal urethral orifice to the external urethral orifice. It conveys or it carries the urine from urinary bladder to the exterior. So it is outlet of urinary bladder. First we will discuss about male urethra, then we will discuss about female urethra. For that we need to take sagittal section of pelvis and the coronal section of pelvis. First I am taking sagittal section of pelvis. So this is symphysis pubis. Behind it urinary bladder, and this is urethra. So this is urethra. Urethra pass through some structures. Because of that we have given names according to the structures which are giving passage to the urethra. So here there will be one gland. What is this gland? Prostate gland. So here prostate gland. Here there will be one membrane. What is this membrane? Perineal membrane. So this is perineal membrane. So urethra passing through the prostate gland, then after that it is passing through the perineal membrane, right? At the anterior part of the perineal membrane, it is thickened to form one ligament. What is that ligament? Transverse perineal ligament. So this is transverse perineal ligament. Below the symphysis pubis you can find one more ligament. What is this ligament? Arcuate pubic ligament. In between these two ligaments there will be gap. Through that gap dorsal vein of penis and dorsal nerve of penis will be passing. You must be studied that in the perineum. Then this part of the urethra passing through the bulb. Which bulb? Bulb of the penis. So here I am drawing bulb of penis. So this is bulb of penis. So this is bulb of penis and this is corpus spongiosum. So urethra passing through the corpus spongiosum. Here one more erectile tissue will be there. Let me draw that also. This erectile tissue, what we are calling corpus cavernosum. So this is corpus cavernosum. Is it? Now if you draw structure which is present behind the urinary bladder in case of males, what is that structure? This is rectum and anal canal. Now if you draw one membrane which is extending from the anterior abdominal wall to the perineum, that membrane is fascia scarpa. Actually this is deep layer of superficial fascia of anterior abdominal wall. Actually superficial fascia having two layers, superficial layer and deep layer again. Superficial layer is fascia camphor, that is fatty layer. Then membranous layer is there, that membranous layer what we are calling fascia scarpa. So this is fascia scarpa. This fascia scarpa, when it enters into perineum, it changes its name. What is the name now? Collis fascia. So this is collis fascia. Surrounds penis, then it surrounds scrotal sac. So this is scrotal sac. Posteriorly it attaches to the posterior border of perineal membrane. So here in between the perineal membrane and fascia collis, this space is superficial perineal space or superficial perineal pouch. You must be studied in the perineum, right? Now let me draw the skin. This is skin. What is this? Prepuce skin or foreskin. And behind the rectum sacrum will be there, right? So here sacrum. Right? So this is sagittal section of male pelvis. Here deliberately I given bit more space because I need to draw some other structures here. What are these? This is seminal vesicle, right? And what is this? Duct of seminal vesicle. Duct of seminal vesicle united with ductus deferens. That means it united with vas deferens and forms the ejaculatory duct. So that ejaculatory duct will be opening into the prostatic urethra. So I am going to show that. Let me draw testis here. Here testis, here epididymis. This is tail of epididymis, and this tail of epididymis continues as vas deferens. Of course, here urethra will be there. This vas deferens and this duct of seminal vesicles united and forms ejaculatory duct, right? So this ejaculatory duct opening into the prostatic urethra. Before that, let me tell you one more structure here. Here there will be one cul-de-sac or one blind sac which will be extending backwards. What is this? Prostatic utricle, right? So there will be prostatic utricle, and here what is this? Ejaculatory duct. So there will be opening of ejaculatory duct into where? Into the prostatic urethra. Clear? So this is the sagittal section of male pelvis, right? Now I will take the coronal section of male pelvis through the urethra, so that some features I can explain in the sagittal section, some features I can explain in the coronal section. That's what here I am drawing coronal section of pelvis. Actually it is schematic view if you want to say strictly. This is urinary bladder. This is neck of the urinary bladder. This is neck of the urinary bladder. This is neck of the urinary bladder. Then this is prostatic urethra. Here membranous urethra. This small part is membranous urethra. Then bulbar urethra. It is present in the bulb of the penis. Then penile urethra. Urethra which is present in the phallic part of the penis. So this is penile urethra. This is spongy part. That means which is present within the corpus spongiosum. See, this part of the urethra present in the corpus spongiosum, right? Then we have to draw corpora cavernosum also. So let me draw corpora cavernosum here. Here it is having crura, right? Here there will be this gland. What is this gland? Prostate gland. So let me draw prostate gland here. Within the urinary bladder, you can see the openings of ureters. So here one ureter, here one ureter. This is trigone of urinary bladder. Here we have to draw one membrane. What is this membrane? Perineal membrane. So this is perineal membrane. Above the perineal membrane, there will be bulbourethral glands. Is it or not? Here also there will be bulbourethral glands. Let me draw bulbourethral glands here. So these are bulbourethral glands, and this is duct of bulbourethral gland opening into the bulbar urethra. So here also bulbourethral glands. This is coronal section and this is sagittal section. Now we will see what are the different parts of the urethra and what are the different features which are present in the different parts of urethra. First we will divide this urethra into two parts. This is anterior part and this is posterior part. That means from the bladder neck to the membranous urethra, from here to here, this part is posterior part. From here to here, this part is anterior urethra. That means this is posterior urethra and this is anterior urethra. Otherwise, this is proximal urethra and this is distal urethra, right? So from here to here, posterior urethra or proximal urethra, and from here to here, this is distal urethra or anterior urethra. Posterior urethra further divided into different parts, anterior urethra also further divides into different parts. That we will see one by one. Here small part is there. This part extending from bladder neck to the prostate gland. See this small part here, this small part is there which is extending from bladder neck to the prostate gland. So what is this part? Pre-prostatic part or pre-prostatic urethra, because it is present before the prostate gland. So pre-prostatic urethra. So this is pre-prostatic, right? Then part of the urethra which is present within the prostate gland. So this part of the urethra, what we are calling prostatic urethra. This is pre-prostatic urethra and this is prostatic urethra, right? Then the part of the urethra here, small portion, this small portion which is passing through the membrane. Which membrane? Perineal membrane. So this part of the urethra, what we are calling membranous urethra. Then from here to here, this part, what we are calling phallic part of the urethra or spongy urethra. So this part is phallic part or spongy urethra, right? So within the spongy urethra, the part of the urethra which is present in the bulb of the penis, this part of the urethra, what we are calling bulbar urethra. These are the different parts of the urethra. Now if you take the transverse section of different parts of the urethra, how lumen will be? First I am taking transverse section at the level of pre-prostatic urethra. Here pre-prostatic urethra. The shape of the pre-prostatic urethra is stellate or star shaped. Pre-prostatic urethra, if you take the transverse section, lumen is star shaped. Then if you take the transverse section at the level of prostatic urethra, it is semilunar or half moon shaped. That means it is curved from side to side. So it is arched from side to side, because here there will be crest will be there. That crest what we are calling urethral crest, that we will discuss. Then if you take the section at the level of membranous urethra, here this is also star shaped. Lumen is star shaped. Then if you take the section at the level of bulbar urethra, here bulbar urethra, at this level, the lumen of the urethra is trapezoid in shape. That means lateral wall and floor is larger than the roof. So it is trapezoid in shape. Then if you take the section at the spongy urethra, it is transverse slit. It is transverse slit. Then if you take the section at the base of the glans penis, see this is glans penis. If you take the section at the level of base of the glans penis, it is inverted T-shaped. It is like this. It is inverted T-shaped. Then if you take the section at the external urethral orifice, it is vertical slit or sagittal slit. So these are the different shapes of lumen when you take the cross section or transverse section at the level of different parts of urethra. So what is the function of it? Why there should be different shapes? Because of this irregularity of the lumen only, urine flow is projectile and spiral twist, and it prevents the early separation of urine droplets. Because of that only, man can urinate in standing position without wetting himself. Now we will see the measurements of male urethra. Totally it is around 18 centimeters. It is 18 centimeters in length. Then if you see the width is vary from part to part. If you take the minimum width, it is at this part. That means at the external urethral orifice. It is around 4 millimeters in diameter. Then next minimum, it is at the level of membranous urethra. So next minimum is 5 millimeters in diameter at the membranous urethra. Then if you take the maximum diameter, here prostatic urethra, it is around 8 millimeters. Average diameter is around 6 millimeters. These are the measurements. Now we will discuss one by one about pre-prostatic urethra, prostatic urethra, membranous urethra, spongy urethra. First we will take prostatic urethra. Before that, let me remove this. Now I am taking pre-prostatic urethra. This is pre-prostatic urethra. This pre-prostatic urethra present in between the bladder neck and prostate gland. If you want to say specifically, which is extending from the bladder neck to the colliculus seminalis. Now we don't know what is colliculus seminalis. That's what at this point of time you remember that it is extending from bladder neck to the prostate gland. So this small part what we are calling pre-prostatic part. This pre-prostatic part contains internal urethral sphincter. That means it is surrounded by smooth muscle fibers. They forms sphincter. That sphincter what we are calling internal urethral sphincter. What is the function of it? Internal urethral sphincter maintains the continency of urine. That means it prevents the dribbling of urine from the urinary bladder through the urethra. That means it will tightly closes the neck of the urinary bladder. Then it prevents the retrograde ejaculation. What does it mean? Actually, in case of females, urethra is only for the passage of urine. But in case of males, urethra is for the passage of both urine and semen. Is it? So, here there is opening of ejaculatory duct. Right? So, during ejaculation, if there is no internal urethral sphincter, what will happen? This ejaculated semen enters into urinary bladder. If there is competent internal urethral sphincter, retrograde ejaculation will not happen. If there is damage to the internal urethral sphincter, which leads to incontinence of urine and retrograde ejaculation. That means if there is damage to the urethra, there will be ejaculation of semen into the urinary bladder. What will happen if it happen that? Infertility. During ejaculation, semen will not be entering into the vagina. It is entering into the urinary bladder. So, which leads to infertility. Right? When it will happen? During surgeries of bladder neck and during transurethral resection of prostate gland. Transurethral resection of prostate gland. When you are removing the prostate gland through the urethra, in case of cancers, that time there will be chance of injury to this sphincter. So, which leads to retrograde ejaculation. This is about pre-prostatic urethra. If you want to say measurements, it is around 1 to 1.5 centimeters. Length is 1 to 1.5 centimeters. Then coming to the prostatic urethra. I am taking this prostatic urethra here to show all structures properly. This is prostatic urethra. Right? Of course, this is pre-prostatic urethra which is surrounded by sphincter. Then this part is surrounded by what? Which gland is this? What is this gland? Prostate gland. Then it is fusiform in shape in the coronal section. See, it is like a fusiform and it is most dilated part. At the middle, it is around 8 millimeters. And what is the length of it? It is around 3 to 4 centimeters length. If you take the transverse section, it is concentric in shape. Why? Here in the posterior wall, imagine this is prostatic urethra. From the posterior wall, there will be one crest or one longitudinal mucosal fold extending forwards. That crest what we are calling urethral crest. So, this is urethral crest. This urethral crest is median longitudinal fold of mucous membrane. It is median longitudinal fold of mucous membrane. It is formed by insertion of trigonal muscles of ureters. Actually, if you see from the side view, that urethral crest will be like this. Right? So, this is median longitudinal fold of mucous membrane. So, this median longitudinal fold from above downwards, the anterior posterior diameter is going on increasing up to the middle part. Right? Here it reaches to the 3 millimeters. Then from the middle part, it will be fades out by dividing into branches. So, this crest what we are calling urethral crest. So, this is urethral crest. So, this is urethral crest, right? And here this is urethral crest. Clear? Then at the middle of the urethral crest, you can see one oval elevation. Here you can see the elevation. This elevation what we are calling colliculus seminalis. In the middle part of the urethral crest, you can find one oval elevation. That elevation what we are calling colliculus seminalis. Colliculus seminalis. This colliculus seminalis we can also call as verumentanum. Colliculus seminalis or verumentanum. What is the importance of it? Here there will be opening of one utricle here. What is this utricle? This one. Prostatic utricle. It is like a cul-de-sac. See, I have drawn like blinded sac. Right? This blinded sac what we are calling prostatic utricle. If you want to see the side view, you can draw like this. This is prostatic urethra and this is cul-de-sac. What is this cul-de-sac? Prostatic utricle. This is anterior lobe of prostate gland. Here median lobe of prostate gland. Here posterior lobe of prostate gland. This is sagittal section through the prostatic urethra. Here this sac what we are calling prostatic utricle. Prostatic utricle. Developmentally it is derived from fusion of two paramesonephric ducts. Actually in case of females these two paramesonephric ducts united and forms the uterus and the upper part of vagina. But in case of males there is no need of these structures. That's what these structures will be degenerated and remain only small part. This small part what we are calling prostatic utricle. It is homologous with the vagina in case of females. That's what this part what we can call masculinus vaginalis. Masculinus vaginalis. Because it is homologous with the vagina of females. According to some other views, it is homologous with the uterus. That's what they given the name as prostatic utricle. Actually this prostatic utricle surrounded by fibromuscular connective tissue. Then mucosa of this prostatic utricle contains some mucus secreting glands. Right? Those mucus secreting glands will be opening into this sac. That is about prostatic utricle or masculinus vaginalis. Then there will be opening of this duct into where? Into the colliculus seminalis on either side of it. What are these structures? Opening of ejaculatory duct. So here opening of ejaculatory duct. This is about colliculus seminalis. Then here this is urethral crest. It's like a crest. It's like a projection. If it is projection, on either side of the projection there will be gutter or there will be sulcus. That sulcus what we are calling urethral sinuses. So here one urethral sinus, here one urethral sinus. Is it or not? If there is a projection, on either side of the projection there will be gutter or there will be depression. The depression on either side of the urethral crest what we are calling urethral sinus. So these are urethral sinus. Into the urethral sinus there will be opening of prostate gland ducts or ducts of prostate gland. Imagine these are the secretory elements of prostate gland and ducts of these gland will be opening into here, into the urethral sinus. So here ducts will be opening into the urethral sinus. Which ducts? Prostatic ducts. Recollect once again. This is coronal section of prostatic urethra. In the coronal section of prostatic urethra, it is fusiform in shape. It is crescentric in cross section. Why? In the posterior wall of prostatic urethra, there will be one longitudinal fold of mucous membrane. That longitudinal fold of mucous membrane, what we are calling urethral crest. On either side of urethral crest, you can see the sinus. Into the sinus, there will be opening of prostatic ducts. In the middle part, it shows one oval enlargement. That oval enlargement, what we are calling colliculus seminalis. Into the colliculus seminalis, there will be three structures are opening. One is prostatic utricle. It is cul-de-sac which is present below the median lobe of prostate gland, above the posterior lobe of prostate gland. You must be studied in the urinary bladder, uvulae vesicae. That uvulae vesicae is formed because of this median lobe, right? Then on either side of the prostatic utricle or masculinus vaginalis, there will be opening of ejaculatory duct on either side. This is about prostatic urethra. Next we will discuss about next one, that is membranous urethra. Let me remove this. This part is membranous urethra. Here this part of the urethra is passing through the perineal membrane. That's what this urethra what we are calling membranous urethra. If we take the measurements of it, anterior wall of membranous urethra is 2 centimeters. Then the posterior wall of membranous urethra is only 1.25 centimeters. Why? See here, bulb of the urethra attaching to the perineal membrane very closely in the posterior part, but in the anterior part there is some gap in between the bulb and perineal membrane. That's what anterior wall is longer than the posterior wall. Then this membranous urethra surrounded by external urethral sphincter. If you take membranous urethra, this is membranous urethra. This membranous urethra surrounded by sphincter. That sphincter what we are calling external urethral sphincter. This external urethral sphincter is formed by urethral smooth muscles, urethral striated muscles and pubo-urethral part of levator ani muscle. These components united and forms external urethral sphincter. This external urethral sphincter is under voluntary control. Mainly it is surrounded by striated muscles, that means skeletal muscle fibers. Actually, if you wanted to say specifically, those are slow twitch muscles. These muscles produces sustained contraction for prolonged time. Is it? So this is about external urethral sphincter. This external urethral sphincter will be present here, right? And it is under voluntary control. Actually, it is under the control of pudendal nerve, right? So that is about membranous urethra. Then coming to the penile urethra or spongy urethra. Spongy urethra shows two dilatation. One dilatation in the bulbar urethra and another dilatation in the glands penis. So this dilatation what we are calling bulbar fossa. So this fossa what we are calling bulbar fossa. And what is this fossa which is present in the glands penis? This fossa what we are calling navicular fossa. So this is navicular fossa and this is bulbar fossa. Only these two areas there will be dilatation. That's what those structures what we are calling fossa. This is bulbar fossa. This is navicular fossa. We can also call as terminal fossa. Remaining part of the urethra is uniform. It is around 6 millimeters in diameter. Now, what are the other features which are present in the penile urethra? There will be urethral glands. See, here there will be some glands which are present in the mucous membrane and they will be opening into the urethra. Those glands what we are calling urethral glands. Let me take separate picture for it. Imagine this is urethra. Here there will be some glands. Those glands are mucous glands or simple mucous glands. These simple mucous glands are opening into the urethra, right? So these are urethral glands. Urethral glands we can also call as urethral glands of litter or Litter's glands. Along with these urethral glands you can find some recesses. Those recesses what we are calling urethral lacunae. Here you can see some pit-like recesses. These pit-like recesses what we are calling urethral lacunae. Actually almost all urethral lacunae are equal in size except one that is present. Imagine this is sagittal section of penis. See here, this is navicular fossa. At the base of the glands penis or at the roof of the navicular fossa, there will be one larger recess or one larger lacunae. This larger lacunae what we are calling lacunae magna. Magna means larger. Lacunae means it's a recess. So this lacunae what we are calling lacunae magna, right? This lacunae magna guarded by one mucosal fold. That mucosal fold what we are calling valvulae Guerin or valve of Guerin, right? Here you can see the mucosal fold. This mucosal fold what we are calling valve of Guerin. This is about penile urethra. Now we have seen all the features of it. Now we will see relations of prostatic urethra and relations of membranous urethra, because remaining structures don't have much relations, just they are passing through the different structures. Here we need to see some relations. See here, prostatic urethra anteriorly related with anterior lobe of prostate gland. That's it. Laterally related with lateral lobes of prostate gland. Then posteriorly median lobe of prostate gland and posterior lobe of prostate gland. That's it. These are the relations for prostatic urethra. Then what are the relations for the membranous urethra? Here one vein will be passing in between the transverse perineal ligament and puboprostatic ligament. One vein is passing. What is that vein called? Dorsal vein. So anteriorly dorsal vein, then on either side bulbourethral glands and ducts of bulbourethral glands. That's it. Now we will discuss about blood supply. Blood supply of urethra mainly by two arteries, urethral artery and dorsal vein of penis. Both are branches from the internal pudendal artery. You must be studied in the perineum. Urethral artery and dorsal artery of the penis. These are the branches from the artery of the penis, right? Artery of the penis itself is a branch from the internal pudendal artery, right? So you remember that arterial supply is by urethral artery and dorsal artery of the penis. Then venous drainage. See here, this is dorsal vein. This is dorsal vein of penis. This dorsal vein of penis carrying the venous blood from the penis and it opens into internal pudendal vein. From there, venous blood opens into prostatic venous plexus. From the prostatic venous plexus, venous blood will be entering into the internal iliac vein. That is venous drainage from the anterior part. Then what about posterior part? Very simple. Veins from the posterior part of the urethra drains into prostatic venous plexus and vesicular venous plexus. Then finally opens into internal iliac vein. That is about venous drainage. Then we will discuss about nerve supply. Nerve supply is by sympathetic, parasympathetic and somatic. What are sympathetic nerves and what are parasympathetic nerves and what are somatic nerves? We will see one by one. Preganglionic fibers of sympathetic nerves arising from L1 and L2 spinal segments. From there, these nerve fibers reaches to the superior hypogastric plexus, right? So here superior hypogastric plexus. From the superior hypogastric plexus, urethra will be supplied, right? So this is sympathetic innervation. Then if you coming to the parasympathetic innervation, preganglionic fibers from the S2, S3, S4 pass through the pelvic splanchnic nerve. They pass through the pelvic plexus and they supplies to the urethra, right? So this is parasympathetic innervation. Then somatic. Somatic innervation also by S2, S3, S4. From these segments there will be origin of one nerve, that is pudendal nerve, right? Through the pudendal nerve it will be supplied mainly to the external urethral sphincter. Is it? It is under the voluntary control. Actually nerve supply of external urethral sphincter is controversial, but according to some authorities there will be one nuclei which is present in the S2 spinal segment. That nuclei what we are calling Onuf's nuclei. From this Onuf's nuclei, neurons are coming and supplying to the external urethral sphincter. This is the nerve supply. Then lymphatic drainage. See, posterior part of the urethra. See, up to here this is posterior part. Posterior part of the urethra drained into internal iliac group of lymph nodes. Few lymphatics will be opening into external iliac group of lymph nodes also, but mainly they drains into internal iliac group of lymph nodes. Then anterior part of the urethra drained into deep inguinal group of lymph nodes. Then we will discuss about applied aspects. Usually membranous urethra will be ruptured during the fall on the perineum or mechanical injuries during the catheterization, which leads to accumulation or extravasation of urine in the superficial perineal pouch. If there is rupture below the perineal membrane, extravasation of urine within the superficial perineal pouch. This extravasation will not extend behind because this colliculus fascia is attaching to the posterior border of perineal membrane, right? And it will not extend into the thigh because fascia scarpa blends with deep fascia of the thigh, that is fascia lata. Then on either side there will be ischiopubic ramus. Clear? So it cannot go posteriorly, it cannot enter into thigh, so that extravasation of urine will be within the scrotal sac surrounding the penis. Then it extends up in between the colliculus fascia and external oblique abdominis muscle, right? It may extend up to the Giffard process, sometimes it may extend up to the axilla also, right? So that is extravasation if there is injury to the urethra below the perineal membrane. If there is injury above the perineal membrane, there will be extravasation of urine in the extraperitoneal space which is present around the urinary bladder. So in this space there will be extravasation in case of urethral rupture above the perineal membrane. This is the consequence if there is rupture of urethra. Then in case of gonorrhea and all, there will be inflammation of urethra, that condition what we are calling urethritis, right? Then congenital anomalies. Actually external urethral meatus or external urethral orifice should be opened at the tip, but if there is opening here instead of here, this anomaly what we are calling hypospadias. Hypo means below, right? Below the penis there will be opening of external urethral orifice. In that individuals, urine will be coming out from here. So this is hypospadias. In some conditions there will be epispadias. Epi means what? Above. Instead of here, this urethral orifice will be opening here. This anomaly what we are calling epispadias. This is hypospadias, this is epispadias. So when that individual is urinating, urine will be coming out through this route. So this is about epispadias and hypospadias, right? Actually this is normal. This is hypospadias and this is epispadias. Then during transurethral resection of prostate gland, there will be chance of rupturing of internal urethral sphincter, which leads to retrograde ejaculation, right? That we have already discussed. Another applied aspect is catheterization of urinary bladder. Actually in some cases patient unable to urinate in the normal process. In those cases we have to introduce catheter. That catheter we can also call as Foley's catheter. What is that? Foley's catheter. We have to introduce Foley's catheter through the urethra, and when it reaches to the urinary bladder there will be one balloon. We have to inflate that balloon. So this catheter what we are calling Foley's catheter, right? So here inflated balloon, right? So this is catheterization of urinary bladder. When we are doing catheterization, one should have idea about normal curvatures of urethra and also direction of urethral lacunae. See, urethral lacunae will be facing forwards. When you are inserting catheter, instead of inserting through the urethra, if you insert through the urethral lacunae, which will lead to false passage of urethra. So you may rupture the urethra and that catheter will not enter into urinary bladder. So these things you have to keep in mind. Normal curvatures and facing of urethral lacunae. Urethral lacunae will be facing forwards. So that is about catheterization of urinary bladder. Then another applied aspect is during resection of prostate gland or during genital surgeries, there will be chance of injuring the one nerve called cavernous nerve. Actually it is parasympathetic nerve. If you injure that, which leads to erectile dysfunction. Actually that nerve is responsible for the erection of penis. If you injure that nerve, which leads to erectile dysfunction. So you have to keep that also in mind when you are doing resection of prostate gland. Because of that, these days surgeons are doing nerve sparing surgeries. That means they will identify the nerve and they will spare that nerve either by visual identification or by means of one equipment called penile plethysmograph. What is it? Penile plethysmograph. Plethysmography. Right? Actually, with that process, we can stimulate the cavernous nerve so that we can measure the erectile function. These are the few applied aspects related to male urethra. That's it about male urethra. Next we will discuss about female urethra.